So the approach that we've taken for the implementation of Radar Healthcare within North Bristol Trust is not just a system implementation, it's very much process redesign alongside, system implementation. So we've worked with each of the modules, each of the work streams to really understand their process, make it as simple as possible for the busy end user, whilst making sure the functionality works alongside the process, and try to standardise as much as possible so that we can have that cross-functional working with all the different areas of the hospital to give that transparency and visibility to members of staff, to the board, to be able to act on that.
I think Radar Healthcare have been really sympathetic to the issues that are ongoing in an NHS trust. We've been able to work through with that real focus on simple standardisation for our end users to make sure that the tool is as easy to use with as little in-depth involvement so people can just pick it up and get it working.
It's a very intuitive tool, and we've had to do the work behind the scenes with our sort of stakeholders and workstream leads and with Radar, working in partnership with Radar Healthcare to make sure that we're making it as simple as possible for them. So it's very simple for the end user, however there's lots of work gone into making it that simple for everyone.
So the audits module has been our first lead out to the frontline staff. So we've rolled out other modules to a smaller group of people, but this has been our first large rollout to a wider cohort of people. And again, it's been that we want to make it simple for them to use and easily accessible for them to use on a number of devices. So they can log in from a computer, but they can also use an iPad and walk around and do their audits as they're working. I think that'll be a real benefit and has been a real benefit so far in our early deployment.
So audit specifically was the first module that we really used the end users, the busy frontline staff. Some of the earlier processes that we'd implemented were central teams. There's been a lot of digital change that the end user had to deal with within the trust, so we absolutely didn't want to give them anything that wasn't going to be fit for purpose and right first time and as simple as possible. So it was really important that it was right and that it was accurate. So we worked very closely with Radar Healthcare to make sure any changes needed to be made, analytics was working as it needed to be, just to make sure that, we didn't have any negative implications of the rollout on such a busy, digitally fatigued workforce.